Good morning, everyone. It is 9:05, and I will call this Community Homeless Advisory Board meeting to order. We will first start with a salute to the flag, and if Councilwoman Taylor can please lead us in that salute. To the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you very much. We will now go into roll call. Madam Clerk.
Commissioner Hill, Chair.
Here. And it's Ms. Taylor, who is our Vice Chair. The agenda is wrong.
Okay.
Just sorry, Madam Clerk.
Councilmember Taylor, Vice Chair.
Here.
Ed Lawson, Mayor.
Here.
Councilmember Devin Reese.
Here.
Let's see. Councilmember Dare
Here.
and Commissioner Clark.
Present.
And our DA today is Herb Kaplan. Madam, you have a quorum.
Thank you so much. We'll now move into public comment. This is comment heard under this item will be limited to 3 minutes per person, may pertain to matters both on and off the board agenda. The board will also hear public comment during individual action items with comment limited to 3 minutes per person. Comments are to be made to the board as a whole. And Madam Clerk, I'll throw it over back to you.
First up, we have David Nyberg, followed by Susan Muski.
Good morning. My name is David Nyberg. I work with St. Paul's United Methodist Church here in Reno. My mission is to the shunned of Reno and Sparks. I work with those who often find nobody else who's willing to work with them. First, I think it's quite clear that there is agreement that the CARES campus is quite a good step forward, that it's been a success, and it's really been an improvement over the old Record Street shelter, which, if you ask Sean Griffin, was a great improvement over what there was before. We look much better than Portland. We look much better than San Francisco, and we look much better than Oakland. But I'm afraid if we don't plan to take the next step, we will eventually look the same. Because at one point in time, Portland looked good. They looked like they were cutting edge, but no longer. I see the next step being essential to classify the difference between those who are chronically homeless and those who are transiting through homelessness. We really need to free those who are transiting through homelessness from the streets and get them immunity from the theft that goes on in the shelter, from the aggression that's going on in the shelter, for that added stress that's going on in the shelter. I work every day with people who are either homeless or on the verge of homeless. I haven't worked with somebody on this since last night, and my next appointment is with somebody who we're trying to prevent them from becoming homeless. But I think our success rate will climb if we can work with the different types of class. There is a distinct difference. Trudy Myers and her crew there are doing a great job. It is very difficult what they're doing. They're following their policy. We need to have a policy that recognizes the difference there between the chronic homeless and those transiting through it. A second-level shelter for the non-chronic homeless and the newly employed would really benefit us. I would look at such a thing and try to figure out a cutting-edge way of doing it. Don't get into the new SEG grant funds, Try to find a way to do it in an innovative way. Looking around, I don't know all the properties that are available in the area, but the one that has really struck me over the time has been the National Guard barracks instead. I think that we could get Grant to help us put together crews of people, offer them housing and a very small amount of money to work on rehabbing such properties. Let's make this a priority, a second-level shelter.
Thank you.
Susan Muski, followed by Paul White. I'm sorry if I mispronounced your last name.
For the record, Sue Meiske, a resident of Washoe County, District 5, and a senior advocate. I'm here today just to remind folks that one of the largest and fastest growing segments of the unhoused population are seniors. Part of it has to do with the fact that we're a part of the baby boom, and every part of our world has been a trend. The other part, though, is about seniors who are losing their homes, perhaps because of a divorce or the death of a spouse, and they're no longer able to cover the costs of maintaining their home, and they cannot afford the rents that are available in this community. So you're seeing folks who have been long-term homeless who are senior, but you're also seeing a lot of new folks who are seniors. I think that as you all have these discussions, please, please keep in mind that the senior population is one of those populations, and they have unique issues having to do with transportation, the fact that many of them aren't driving anymore, or they can't walk very well, they can't get on a bus, so the ability to get around is not there. The other issue is healthcare. As we get older, and I'm so much an advocate, the healthcare issues just multiply, and those also impact a person's ability to access housing, to go look for it, to find it. So again, I would just encourage you all, as you are looking at solutions, don't forget that your seniors need help as well. Thank you.
Thank you.
Paul White, followed by Frankie Sue Del Papa.
I'm very pleased to announce that after years of trying, we're going to be able to invite you pretty soon to something that's long overdue in our county. It's going to be a debate, not a forum. It's going to be a very vigorous debate represented on about the entire homeless program issue in our county. On one side will be a very we're finalizing the details. On one side will be a very respected voice with the CARES program. On the other side will be Education Crusade, who is helping co-sponsor this. And it will allow, we're hoping that it's an event that no politician or attorney who deals in those issues or law enforcement officer or social worker or probation officer, no one will want to miss, because it will be a very stark opportunity to look at, on the one side, the claims of the CARE Campus program and its record over the years versus a diametrically opposed position by Education Crusade with 50 years behind it that says the problem has been completely misdiagnosed and that the direction we are leading can never do anything but continue to get worse. So it's an event you're not going to want to miss. Again, we'll be promoting it widely, and we look forward to providing the best thing that you can provide a community, which is truth and honesty and facts and sincere opinions on both sides of an issue, and then trusting that they'll make good decisions. Thank you.
Thank you.
Frankie Sue Del Papa, followed by Reverend Claire Novak.
Good morning, everyone, and thank you for your service and time on this important issue. A couple of years ago, December 19th, I was in a wine bar on 4th Street, which I don't normally hang out. It was a Reno City Council fundraiser. And in walked in a gentleman with a sheet of paper in his hand. It was his eviction notice. He wasn't begging. He was looking for work because he was $40 short on his rent from the El Centro the next day. It was snowing. He'd walked over from El Centro there. We, of course, gave him the $40. I called the Reno housing people myself to tell him that he had his money to make certain he wasn't evicted the next day. The eviction notice had been postponed until December 26th, but he didn't know that. I'm here to tell you that we need to do more in addition to everything else that we're doing. We need to figure out a way to keep people in their housing. Do not let them be evicted for $40. That's number one. Number two, I visited the Eddy House the other day and was heartbroken, but gratified at what they're doing there. But our homeless rate among our youth, I was told by Trevor, is up 40%. I mean, we've got huge issues. As you know, the Eddy House only serves those 18 to 24. What about the 17-year-old? I mean, we've got to do more on both of these ends in this comprehensive issue. And so I'm here to tell you that as a private citizen, this whole thing shook me up to the point where I made a donation to the Housing Authority to provide those bridge funds, and I intend to do more. I think we need to reach out to the court system. There needs to be perhaps a separate little task force in that regard as well. But I think these are very important issues. I commend all of you. Last night when I was driving home on 4th Street from the other direction, you know, the tents there are just, it's heartbreaking to see this in our area. So again, I commend all of you for your interest, and I think that we need to do as much as private citizens in terms of collaboration, cooperation, et cetera, but we really need to somehow figure out to get these other entities involved as well. Thank you so much.
Thank you.
Reverend Claire Novak, followed by Erwin.
Good morning, board members. I'm Reverend Claire Novak with Faith in Action Nevada and the United for Action Coalition, and I'm here to urge the board to carry forward 3 recommendations that are in line with your goals. First, for community engagement, to add to this board a person who has lived unhoused in our region. This will ensure a voice at the table with direct knowledge of the community you're serving and a perspective on how policies for safety and support are being carried out. And Faith in Action Nevada can help you identify individuals with this experience and interest in joining the board. Second, for better community communication, to make regular reports on progress toward the targets in the Washoe County Regional Homelessness Plan, and to post those regular reports on the county website. In January 2022, the plan set 6 regional priorities for sheltering and housing, and also specified measures for success. What progress can be measured in each area? It's important for the public to know, and to know which entities are responsible. And third, for a unified regional approach to homelessness, to request a formal review of how the illegal camping ordinances have been enforced and their effect on individuals across all jurisdictions. Have these ordinances supported or undermined the Regional Homelessness Plan's goal that homelessness is rare, brief, and non-reoccurring? For this review to be valid, law enforcement and case managers across all the jurisdictions should agree on and collect uniform data with guidance from this board. And this review, ideally, I would say, by a third party, should be complete before the Regional Homelessness Plan expires in January 2025, so we know how we've done. I thank you for your service, for considering these recommendations, which I've submitted in writing. Thank you.
Thank you.
Next up, we have Erwin.
Thank you for allowing us to contribute to this discussion. I'm here today to underscore that the homeless are not only people, but Americans. Given that, if we were to have people lost at sea, we would send out boats. If we were to have people stuck behind enemy lines in some way, we would find a way to be able to get them home. I think it's very important that we keep this in perspective. Our Constitution gives us the freedom to be whoever we are and live however we want. The very concept of freedom is tricky because two people cannot occupy the same space, they cannot own the same asset, but at the same time, we can't have people just peeing in the pool. So we have to have laws to try to govern us collectively. Loitering and vagrancy laws in their current form, I think, will one day be considered unconstitutional. Loitering was apparently birthed in England to combat jobless people roaming the countryside. In America, we are free to define our own existence, and just as we are free to be in any reason, then we are free to be somewhere for no reason at all. So loitering really, in a sense, is unconstitutional. The vagrancy laws don't just strip you of the right to simply exist as is, but actually criminalize your presence in public, except in homeless camps. Any forced relocation creates an entire class of people subject to the rules of the camps that they are assigned. This is unconstitutional. We cannot strip people of their rights for our convenience. Vagrancy laws could also be considered cruel and unusual. Imagine if you had to look over your shoulder every minute in fear of the police, being told that you are not wanted. You would shrink away into the shadows, dehumanized, feeling the frustration of being an outcast in an unjust society. We must do better. In order to lift these people up, we must give them the respect that they are entitled to as Americans and as people. I propose two things. We should actually strike our vagrancy laws. I understand that it's difficult, but these people should not be ostracized, and we should remain responsible for creating the programs necessary to include and to help those in need, just as, we shouldn't necessarily be saying that it's illegal to sleep in your car. Build laws that only criminalize the acts of wrongdoing. The other thing is, and potentially, maybe we should redefine the loitering laws. If someone can go to a park and hold a space for 8 to 10 hours for a concert or to watch some fireworks, then maybe we should allow a similar time.
Thank you, sir. Thank you.
There's nobody else signed in.
Okay, thank you, Madam Clerk. We will now move on to item 4. This is approval of the minutes for September 11, 2023. And is there any public comment on that, Madam Clerk?
There is not.
Okay. I am looking for any changes from the board or a motion from the board, please. Thank you,
Second.
Councilman Reese. Thank you, Councilman Dare. Any questions on the motion? Seeing none, all those in favor, please say aye. Aye. Any opposed, please say nay. Okay, thank you very much. We'll now move on to item 5, the Washoe County Housing and Homeless Services Overview Presentation of Division, Current Initiatives and Needs. This is Dana Searcy, and a non-action item. Welcome, Ms. Searcy.
Good morning.
Good morning.
All right, well, today we thought we'd switch up our presentation just a little bit to focus not only on CARES Campus, but of all the work of Washoe County in the homeless service arena. Over the last 8 months now, the county has continued to bring all of these resources together. Our division has now transitioned under the Human Services Department, and we have brought all of the homeless work that existed within that department within our division. So now Our Place and CARES Campus and all of our regional work and housing efforts are all together with one group of staff. About 4 years ago, I shared this slide when we first started talking about Vote for Zero and what that might mean for our region. And the reason of this is mostly that homelessness is a very complex system. It's not just the homeless arena, but it's also the behavioral health and the medical health side, as well as the justice system and law enforcement. And really, to sum up what our team does, it's about making sure that all these pieces are able to operate in a coherent way and keep whatever structure and direction has been set for the region. And it is only through this action that we can see this meaningful progress as we all continue in that one direction. So homeless services now, as I just mentioned, includes 3 main sections. One is the regional governance and coordination. This is our Built for Zero work and our COC work. We're going to look at each of these areas through this presentation. Our shelter and services, and also our housing initiatives. When we talk about regional governance, this slide has been shared many a time. This is how our areas are operating right now. Washoe County is extremely focused on that emergency shelter setting as well as permanent supportive housing in order to house our most vulnerable that are in those shelters, and also housing at 30% AMI or below. The continuum of care is defined by the National Alliance to End Homelessness as a regional or local planning body that coordinates housing and services. These are the 6 things that COC does, but really it's much bigger than that. Our Built for Zero work now lives within the COC. All of our new initiatives like tenancy support, like lived experience boards, all of that lives within the COC, which again is that regional governance committee made up of many different nonprofits and government agencies from the region. And then Built for Zero. Many of you are very familiar with this. They are now over 105 communities that are participating in this work. And this foundational work, again, when we started meeting, it was a lot about establishing a by name list and talking about who is that integrated group that is working together, and also a commitment to how are we going to measure success so that it isn't program by program, but community-wide. And where we've come to now is our housing supply and ensuring that money going into housing, those very limited resources, are in a strategic way that actually will address the needs and the holes that have been identified in the region so that we can make sure that they go to the best and most efficient use. The shelter and services. The 2 big shelters at the county are, of course, Our Place and CARES Campus. Both shelters are about reducing barriers. And also, it is not just about providing that bed and meal, but really having the services on site, such as behavioral health, such as medical care, such as connecting people to employment opportunities and support. Our Place, again, just says this is the first time we've done this presentation in this realm. We're putting up just some basics so everyone has some information for some grounding. But this is the capacity, 38 family rooms over at the Our Place facility, along with 102 women's shelter beds, 20 beds for our senior women in the Joy Home, and 24 beds in Hope Home. Our Place is operated by RISE. There are also county staff on site for that behavioral health and case management, as well as operations. In addition to that, they have the early learning daycare center on site managed through Boys and Girls Club, a couple of different boutiques that we are very grateful for, and the garden managed by Soulful Seeds. Over at the CARES campus, I know this is more recent to you all, but we are holding at 549 inside the dorm, 50 Mod Pods, and the 48 beds over at the emergency overflow shelter. Additional 50 units of housing coming on in spring of 2025. VOA operates the shelter, Karma Box operates the Safe Camp, and again, you see county staff here for behavioral health, case management, and operations staff. There are medical services on site provided by MedTrust, and Allied Universal provides security at both campuses. I threw this update in here. This is the construction going on at CARES Campus. The green areas are complete, that Phase 2 and Safe Camp area. Phase 3, we are almost done. We are still looking at a ribbon cutting at that Welcome Center on or about August 1st. Of course, you will all be invited. And then that housing will open in spring of 2025. The yellow area, the Accessible Space Housing Project, will be breaking ground in just a month or two here and is scheduled to open in 2026. And some updates. So one very large update for our contracts, we're going to be bringing forward an amendment to our board on May 28th. This amendment includes a 5% cost of living increase. We have not increased staff wages for those frontline staff in a couple of years. We also are adding a couple of additional staff that will allow us to expand a couple of beds in some specific areas and maintain those staffing ratios that we developed at the beginning to ensure that the campuses have appropriate staffing. And one large increase in those contracts is an increase for outreach and cleanup services around the campus and for the businesses in the area. We've heard a lot of feedback. You guys have heard a lot of feedback about the businesses needing support, and so that support will be coming through this contract. Winter overflow. CARES expanded the overflow from previous years, again, 84 bunk beds. Both at CARES and our place, we were able to expand with cots as needed, up to about 30 cots at our place and at CARES campus and 25 cots over at our place. We were able to adjust those up and down throughout the winter as weather changed and needs were there. Recently, we have announced that we're going to go ahead and close that winter overflow. So the last 2 years in the region, we've closed overflow beds on April 1st. We decided to go ahead and keep them open this year and see how it went. And quite frankly, nobody has left because that piece of the campus is the only piece not under construction. It's very calm and nice in there. So before we announced that we were going to start closing those overflow beds, we worked with all of our partners and identified an additional 140 beds in the region. We'll add, it's not a secret, those beds do have some barriers attached to them, but they are available. And also, when we announced that, which was late last week, we announced that we'd be going through about a 2-week phase down. Anybody who let us know that they'd like assistance in finding a bed or a bed inside the sprung, we're able to accommodate that. Coordination with law enforcement, the justice system, and the hospitals and institutions is increasing. I think we've seen that foundation solidify at CARES campus, and staff have a little bit more capacity to have these conversations and see what kind of services we can add to the site. We have been meeting with multiple different departments from the county, the court systems, the PD and APD, and also several meetings with law enforcement for better coordination between the jail, the courts, and the facilities, and also between the health system, the hospitals and the facilities. And coming soon, prior location data. We've had a lot of conversations about this. There is not currently a specific item inside HMIS that tracks where people have come from prior to entering into our homeless system. There are some general questions about how long have you been homeless and that type of thing. Where did you spend last night? That we use through diversion efforts, but we are going to add some very specific questions about coming to the area, new people coming to the area, so that we can support the need to understand what is happening. Observation-wise and in talking with staff, we are not seeing a huge increase in people coming. We're all hearing it. Build it, you will come. They will come. We do not have that pattern. We have a lot of movement within the state of Nevada, actually, because we offer a lot of services that are not elsewhere in the state of Nevada. So we're working through that as that information becomes known. And also at CARES campus, we'll be adding a clothing closet in the next couple months, as well as that welcome center and outdoor space will be opening. So outcomes. This data is now a combination of all of CARES and our place. We wanted to present big single numbers that were easy to understand. In the last year, actually in 2023, between CARES and our place, we served almost 3,400 unique individuals. There were 520 placements into permanent housing, and recidivism was decreased by 3%, down to 21%. And this is the snapshot at ages that we continue to look at. And someone mentioned it during public comment, but it is really important to pay attention to what is happening with our seniors. And we are seeing that number increase. 42% of everybody inside CARES and Our Place, again, this data is both campuses together, are age 55 and above. And we have seen that very consistent, if not a slight increase over the last 2 years. 54% have a disability, and still sitting at just about a third that are not insured. Our partners, we always like to put this slide up. There are a lot of regional partners on site at both campuses. We couldn't do this work without them. This list grows every day. So local trends, switching a little bit to outside of just the campuses, what is happening. We wanted to put up the PIT count, which was released last week. A slight increase, as you're all seeing. That bed utilization, we also wanted to include those numbers. One of the things that has been said many times in the public is a 50% decrease in homelessness. I want to clarify, the numbers are coming from this graph, and it's actually a 50% decrease in unsheltered homelessness. That is what has been said in the last couple of years. That is from the 780 that you see in the gray in 2021, reducing down to the last 2 years with about 350 unsheltered. So we get asked this a lot. Why are the numbers so different? Why can one number stay the same and one number is going down? Why do we measure things in two different ways? The point in time count here on the left side of this slide, this is mandated by HUD. It is a once a year count in the end of January each year. And the purpose for this is really determining how many resources are sent to our region. The by name list, as many of you are very familiar with, as we've been talking about this for 4 years now, is a way to understand more on a day-to-day level what is happening with trends, where are we seeing increases, so that we can quickly apply solutions or change our methods so that we can address it. It also allows us to see information down to the person level. Again, each person is a unique person with unique needs, and this allows us to do that. And this is the by name count, our by name list. The active count is also how we refer to it. This is showing a year-over-year decrease of over 350 individuals. And again, I caution, we hit quality data in the fall of last year. So before that time, we're looking at still a lot of variability in the numbers because we were still adding new programs, we were cleaning up old data, that type of thing. So now we're just starting to look at this, and yes, we're seeing a positive trend, we're seeing improved numbers, but it is very, very new and it is delicate, and so we're watching it closely. And on the left side of the screen is the inflow and outflow. We started showing this, again, 4 years ago, the very beginning, and the data was so off because we did not have that quality data that it was difficult to follow. And now that that quality data is in place, we're able to see, quite frankly, each month how many people are exiting homelessness or falling into homelessness, which is telling us more information about the trends. You can see these last couple months here over the winter, those little pink dots on the bottom, that is indicating that there are more people coming into homelessness than we are actually housing. So that is a fairly new trend, definitely concerning. We don't have answers yet as to why that is happening. We've heard a lot of information about the COVID era supports that are starting to end. We've had a lot of people show up both on the streets and in the shelters that are saying, I just received my eviction notice, I just lost my job. These are new trends. So we'll be watching this and following it closely. And the housing support. So on the housing side, the county has a couple of initiatives. One is that emergency rental assistance that we received through COVID. This is over $6 million. We are continuing to get that out into the region. At this point, it is targeted towards those in CARES in our place to help people get into those housing units. The Affordable Housing Trust Fund had about $2 million in it this year. It was funded by the County Board of Commissioners. And we are about ready to bring forward to the board 2 recommended projects to fund with those dollars. One of them is targeted towards seniors, and both of them are looking at that very low income for the units that are funded. Tenancy support, there are 77 people in this program at this point. We're seeing extremely good rates coming out of this with who we can help keep housed. And again, this is not quite that permanent supportive housing level, but this is a case manager following people once they have been housed and ensuring that if there's an issue with the landlord, we are able to support, or if there's benefit paperwork that needs to be renewed every year, we can get ahead of that and make sure that we can follow up. The permanent supportive housing side, again, we have 50 units opening at CARES Campus. And we also had an assessment done. Brooke Page is going to present next what that assessment looks like to see just how much supportive housing do we need to support our area. So challenges, housing. That's our very consistent message. We need as much housing as we can possibly get in this area, and very specifically that low and very low income, 30% AMI and below. We also need staff for tenancy support. Again, we're seeing very good outcomes come from this. None of this is new, but we haven't actually put this all on one list, so we thought we'd go ahead and do that. And then in addition to that supportive housing, we're starting to identify the very specific housing needs related to behavioral health and disability, that assisted living, those types of facilities that are also needed in our region. Okay, and with that, happy to answer any questions.
Thank you, Ms. Searcy, for that great presentation. I think it's really wonderful that you explain the numbers, because I think there's misinformation out there in the community. This board and I certainly have never said that we've reduced homelessness by 50%. I've said we've reduced it on the street. We have fewer people living on the river, on the street, because of the CARES Campus, and that shows that we are helping people, getting them that emergency help, and now the next step is the housing, which you really astutely pointed out that we need. So thank you for that work. Two things I wanted to clarify for the board so folks know what you are talking about. On the barriers in other Nevada counties, don't, as you saw, the board saw, and the community on the state of Nevada, we are the only Built for Zero community in the state. So that means we have the lowest barriers for folks to get emergency shelter. We are anecdotally seeing other counties who are sending folks to Washoe County within Nevada. That's something that we are looking at as a region, and I know that our county manager is going to have some discussions with folks, because I think those counties, we want to help people, but they also have to pay their fair share. So just wanted the board to know that as a concern for the increase we're seeing. Additionally, the emergency rental assistance, you had pointed out that COVID relief dollars, that has run out. And so that is where we're seeing people getting evicted, and making sure that we can staff, once we see how successful this tenancy support program is, seeing how we can support that throughout the community and keep people housed, I think that will really be able to turn that around, and then figuring out how we can get more emergency shelter vouchers to our community members to ensure that they are not evicted. So I'm going to start with the board over to my right to see if there's questions and comments. So we'll start with Councilwoman Taylor.
Thank you, Madam Chair. Yes, I do have some questions. Thank you for the presentation, and thank you for everything that everybody is doing as a region. I think I'm hearing that as much as we're doing, we still want to do more. We still need to do more. I'd like to talk a little bit about the overflow shelter. So as my understanding from your presentation, we had 84 beds in the overflow shelter, and those are going to be reduced
Yes.
to what number?
2-0.
To 0. So
Yes.
where will those people go?
So the emergency overflow shelter is a separate building. It is not staffed except for 8 o'clock at night until 7 in the morning. There are no case managers associated with that location. It is truly for emergency winter overflow when it is too cold or too hot and we need additional capacity.
How many people are there now or in April? Are people using the overflow?
So we did see people use the overflow in April, but what we saw is other beds around the community open up because the weather was getting warmer. And as I mentioned, we do believe that some of this is because it is the nicest space at the CARES campus right now. It is the only space that is not under construction. The rest of the campus, for any of you who've recently visited, is under about 90% of it is under construction. It's very difficult to navigate around for the next 3 months until the whole site opens up. So anyone inside, we are connecting with case managers to offer other options, whether that be inside the campus or elsewhere across the community.
And I don't know if it's because of the weather, but personally in downtown Reno, I have seen an increase in unhoused individuals over the
Yes.
last 10 days specifically. This morning, there were 15 people in Westbrook, and that hasn't happened in months.
I appreciate that. We have heard that too. At the time that we received calls last week that everybody said we've seen this increase in unsheltered, what's happening. At that point, the beds on CARES campus had not been reduced and we were not seeing a decrease in their use. So I do not believe that they are related.
So can we jump to think that we will see more people once we start reducing those beds? If we're starting to see it now because of the warm weather, what I'm
Sure.
asking, are people going to be more people out on the street when we reduce the overflow?
I think it's a choice. Anybody who would like to stay at the campus, we will find a place at the campus.
If somebody's at the CARES campus and they want a place to stay, we're going to find them a place.
Yes.
Okay, perfect. The other thing I wanted to ask, if I might, is you talked a little bit about the business support contract in the contract that's coming to the county. What does that look like for the businesses? Because I see a lot of I hear from a lot of businesses along 4th Street, the railroad tracks are a real problem. They're a real challenge. It's not safe. So what does that look like from your perspective?
Sure. In full transparency, I am not familiar with the railroad tracks. I do not believe that this will address that. I know there are very specific regulations around the railroad tracks. I know Reno has partnerships with Union Pacific, so maybe better versed to talk about that. What is in that contract is 2 staff that will work 24 hours a day in and around the CARES campus from Line Drive to the main entrance on Threckle. And in both of those locations, there's a little receiving courtyard. So they will work, again, in and around the campus between Line Drive and Threckle and down 4th Street. And an additional 2 staff that will be staffed during the day and the swing shift that will be focused on the business area east of Wells, which is where the Downtown Improvement District ends. And we will pick it up from there.
So it's sort of an extension of the Downtown Ambassadors?
It is not an extension of the Downtown Ambassadors.
But is it what they're doing, the functions? What functions will they be doing?
Similar, yes.
Okay.
We're
not
putting
part
this-
of the bid.
yes,
It's not
it
part
is
of the
not
bid.
part of the bid. We're putting it in as a pilot program. This is very new to the county, but this is to support with engagement and outreach and helping individuals get to services as well as support to the businesses. This is going to Karma Box. Grant's very familiar with the businesses in the area. A lot of recommendations about fencing and that type of thing, but then also if there are cleanup efforts or that type of thing.
Thank you. I will say my biggest concern was the overflow shelter and hearing that we will get people resources. I do have another question. Do you mind?
Go for it.
So on the housing initiative that you talked about, is there a certain client or somebody or people that we are working with that are never going to want to be in a housing situation by choice? Or do we see, because I see some of those people, I'm working with them on the street, and then is there a zero barrier, no barrier place for those people to be, rather than in parks or sidewalks or businesses?
So right now, the lowest barrier is the Safe Camp, and that is specifically designed to support individuals who are not comfortable coming into congregate care. And that also run by Karma Box. That is a partnership between us and the outreach teams with Sparks and Washoe County and Reno, as well as many of our nonprofits and for-profit partners, to look through and talk about who is currently unsheltered that this might work for, and how can we work through that process. We can't force anybody. It is definitely a personal choice. But when someone chooses, then there are options.
Okay, thank you. Thank you, Madam Chair.
Thank you. And I think it's really important on the resource center piece. We, as a region, came together and fundraised for the CARES campus, as this group knows. And the Pennington Foundation gave us a lot of the funds to make that resource center happen. And that resource center was envisioned to be a place where people could shower, could get their mail, and the entire time when we worked with our donors, we never said it was going to be a full-time shelter. It was going to be that winter overflow, so we wouldn't have to stand up a tent and cost additional funds and have that just built in. So I did want to clarify that. Am I correct, Ms. Searcy, on the record?
That is correct.
Okay,
Yes.
thank you.
Focus with diversion.
Yes, diversion and working on, if folks are one paycheck away from losing their home, we are working with folks at the Resource Center. Thank you. And Councilman Reese.
Thank you, Madam Chair. Ms. Searcy, thank you for the excellent update and presentation. I do have a number of questions, and so I'll try to maybe get them in one pass, and then we'll see what else we get to.
Okay, sounds
Can we
good.
start with some of the slides? I think maybe the CARES Campus construction timeline is the first slide. So first, I want to say thank you to the county for the laboring oar in this area. I know you put up the spectrum scale that shows what are really the county responsibilities and what are the cities. Part of the issue is we know as a region, historically, we are all working together, sometimes overlapping, sometimes not working very well together. I think in the last 5 years, the county has really taken a leadership role that has substantively changed the lives for our most vulnerable citizens. So I thank you for that. This construction timeline, one of the things that I think is interesting here but is not included until the partner slide is really all of the related partners that are near the CARES campus that also provide something. Obviously, Hopes has opened a brand new clinic. I think that might have a transformational impact across the street as the Village on Sage Street, Highway 40, Hope Springs. All of these things are opportunities for people to exit sheltering and move into more permanent, stable housing. The construction that you show beginning in 2024, that's for 50 permanent supportive housing units, is that correct?
That's correct.
And is there a plan for a fifth phase, a sixth phase? What is the capacity of this particular campus to provide those resources?
The yellow area that you see is more housing. That is an additional 50 units of supportive housing and 70 units of low income. That is targeted at 50% and below AMI. The only remaining land that will be left at the campus after all of this construction is complete is about an acre to the west of the current Safe Camp.
And the 70 units that you spoke of, those are not identified on here. What is the timeline for those? Is that a bit more aspirational?
It is it's part of this accessible space. So that project is in 2 phases. The first phase, the 50 units of supportive housing, is due to open in the first half of 2026. And the second phase is currently under they're working on their funding package right now.
Understand.
And the lease agreement with the county stipulates that that will be done by 2029.
And the shelter and service outcomes slide, it identifies total permanent housing placements in 2023. So am I to read this slide to say that the unique clients you have served are approximately 3,400 and the permanent placements are 520, so the difference is around 2,900 folks? What is happening with those folks? And maybe I'll also say, Ms. Ursi, again, I want to, of course, focus on the successes, but what, of course, our community wants to figure out is what more can be done and how can we be more successful. It's not a way to denigrate the successes that you've had, but rather to say, let us stop for a moment, say the permanent placements 520 is awesome, but of course, at this point, my worry is about the 2,900 other clients and the ones that are not indicated on the system because they're not being counted in whatever way we are. So how do we read that slide?
Yes, this slide is, one, we don't have the specific breakdown I don't have it with me today, but that breaks down into two groups. One, other resolutions and exits to homelessness, whether that be one self-resolving, maybe you were there for a week or two, got a paycheck under your belt and helped yourself into a unit and didn't really need support from us. That would also include anything that we would refer to as a positive placement out of the shelter, which might be into Crossroads or some other sobriety or treatment facility. Anything that would be transitional housing would be in that group. The other group that you're seeing here is people that there is not a housing option for. And those numbers are very high. And we can bring that together to show what that looks like. And that's that group I'm talking about, the need for supportive housing, the need for assisted living and behavioral health housing. The truth is, with the shelter being the lowest barrier in the region, what we have accomplished is a lot of people have shelter, but those individuals have very high needs. And in many cases, the housing that is needed to provide the appropriate support does not exist right now, or exists in very limited fashion.
Okay, I appreciate the answer, but maybe it'll dovetail with the second part of it, which is this question about 50% reduction in unsheltered homelessness. Mm-hmm. I think part of the issue that is confusing to folks who are not in government speak is really the concept that you're using different terminology, and sometimes it's talking about the same people, sometimes it's like a Venn diagram of overlapping circles. So help me understand, the 50% reduction in unsheltered homelessness means what? Because most people are just saying, what is homelessness or unshelteredness? There's lots of words being used. Unsheltered homelessness are what? People who were previously on the street and now they've come into services inside of a shelter?
That's correct. That's correct.
But that's not exits to permanent housing placements?
Correct.
So how does... I want to make sure I choose my words carefully because people misinterpret those very often, and I want to make sure that people are understanding what the goal is. With the HMIS data that you've posited and the two different types of counts, you now have a way to measure a more quantitative or qualitative approach to it, which is the by first name list, and you show that on the next set of slides. What is the thing to be celebrated there? What is the positive thing for us on the next trend slide?
Sure. So related to the PIT count, I might just add, you guys can see this bar the last 4 years. There's not been very much change over the last 4 years of that PIT count. Mm-hmm. Now, again, it's a once-a-year snapshot. We see different situations every year. In 2023, it was extremely cold. We had a lot of people in shelter during that time. In 2024, it was very warm. It was unseasonably warm. We had a lot of people leave shelter, and we saw unsheltered increase during that time. But overall, that number, if you're looking at the top of this bar chart, has not changed very much. And again, that is a one-time snapshot. We built a lot of shelter in this region between our place and CARES campus from the original Record Street counts. We tripled capacity. So we saw exactly what we should have seen, which was a whole lot of unsheltered individuals had the opportunity to come into shelter should they choose to do that. But again, not too much of a change there when we're looking at this one-time snapshot. This is your by name list, and again, that quality data mark happened in the September-October timeframe of last year. So anything before that, we are saying that it's pretty accurate, but we don't know for sure that it is accurate. So now we're starting to watch those trends because we have over 95% of all of the housing providers putting into HMIS, and we can see what's going to happen. And you can see we ticked up, and we've just started to see that little decrease We have been very careful. Our team has not said we have seen a significant decrease in homelessness. We have not, again, like you said, it's very easy to get lost in a lot of this data. We've tried to pull back some of the numbers, not be transparent, but to try to simplify, because there is a lot of confusion. There is a lot of pointing to why this number and not that number. This number, the by name list, is what shows our trends. This number is calculating individuals, if you're looking at 1 month, how many individuals have touched the homeless system within the previous 90 days. It is not a today, who are we counting today? It is over the past 90 days, how many individuals have touched that system. And again, we still do not have everybody reporting into this system. But that's what you're looking at here. And the inflow and the outflow, the ability to monitor that is the critical game changer for us at the systems level, right? Not at the individual in front of me and how do I serve this person. But when we're watching the number of people you're seeing, we're housing 500 individuals into permanent housing options, but we are still seeing more individuals fall into homelessness. We're not going to see that number decrease until that stops. And so that is about the housing, that is about our very high rents right now, right? And about our ability to ensure that that number stops, right? How do we catch people before they fall into homelessness and offer those supports?
Madam Chair, I have one more slide, but I'd rather hear from my colleagues and then come back.
Do it. Let's hear it.
Mayor Lawson, you're very kind. Let me just sort of put a point on the conversation that we've just had, because I think it's very important for our body and for our community. You are in this work every day. Is that true?
That's true.
And I apologize, sometimes the lawyer in me comes out, and so it's like a cross-examination. But you're not on trial. No, but you're in the work every day. But we see human suffering every day in this community. And so it's easy to say it's not working because we see people who are in tents along the railroad tracks. We see them in our shopping centers, on street corners. We know that they're in the parks and they're just struggling to survive, right? And yet here you are saying, stay the course, the work is happening, we're making progress. I just want to make sure that we are not lost in the numbers game and that we do stay focused. I have to believe in my heart of hearts that had we not gone down this path together regionally 5 years ago, that the problem would be astronomically higher and we would be talking about a whole set of different conditions. And so for my part, I try to be positive about what I'm seeing, and yet your challenges slide, which is my last slide, is where I would like to end my time. First, you've identified the challenges needing support. I wanted to talk about the very low and low income housing, 30% AMI and below, and just sort of maybe I'll say this is not happening. There are very few people developing this. In our council presentations last week in this very issue, we were trying to target this particular need as well. So what we've come up with as a city of Reno is density bonuses for 30% AMI, layered financing, meaning we're contributing either the land, the financing, or lending our volume cap to it, and we're reducing sewer and building credits. But even then, Ms. Searcy, we have not found people who want to come into this community and build that type of housing. So it seems like a very unattainable goal. We're working with the tools that we have. Is there anything that you're seeing on the county side that is going to target this very specific subgroup?
So a lot. One, I would add, I do think that it's working. I think we should stay the course. I think we built a shelter 3 years ago. Our place opened 4 years ago this month. CARES Campus 3 years ago this month. It takes an enormous amount of time. It took us 4 years to go from having 40% of our programs entering data into that HMIS system up to 95%. And that is a really long time. That is a lot of staff hours to convince everybody of the benefit of doing that. We're just starting to see that snowball move in the right direction. We're just barely starting to see that progress. I think we're also seeing more suffering, more hurt, more strain related to the housing market and the end of COVID resources. And so we've got to get through that, and it might get bumpy, but that doesn't mean that it's not working. We are seeing good numbers into those permanent housing options. We are getting creative. Our teams are all working together and talking. We have made tremendous progress. Your direction, this board, the 3 jurisdictions, it's an enormous amount of progress. We have communities come and see us all the time. We've had 10 different states that have called us, and how do you make this happen? And the answer is always because our electeds are united in how we are developing and supporting with these resources, that is the critical piece of all of this. So please don't change course yet. That does not mean that the work is done, and that's why we're throwing up these lists. You know, the reality is the first goal was get everybody enough shelter. So now there is enough shelter. It's how do we build out those housing options for everyone who needs them? And they're not easy solutions, and you are right. It is not pencil most of the time for programs to come in and say, I'm going to build a supportive housing unit. It does not pencil without the community support. And so at the county, again, we dedicated $2 million to that Affordable Housing Trust Fund that is going out to support these projects, 30% AMI and below. We also are, again, dedicating the staff, because sometimes if the program cannot pencil at 30% with the case managers, if we can support with the case managers, maybe that will make the program pencil. The county, and also through the vision of the 3 jurisdictions, 3 acres of that CARES campus was dedicated to a permanent supportive housing option. Accessible space came in. They have a lease with the county. That project would not pencil without that lease. So those are the types of things. Brooke is going to speak to you next about this very specific type of housing, and the legislature is putting up funding. There's AB 310. That funding that we're all watching as a region very closely to get some of that into the region and show that we do need that support. But it is very serious. It is very expensive. The county has also, as you are all aware, purchased the West Hills facility and is looking at treatment options for behavioral health in that facility. Housing after that will definitely be the next piece of that conversation. There's a lot of treatment and then needs and then the housing needs that come after. It's a lot to do.
Thank you. Mayor Lawson. I'm good. Okay. Councilman Dare.
Yeah, I'll just have 2, and some of it has to do with what you just said, and so maybe it will be answered in the next piece of it. But how do we care for those who should not even be in the house, in the CARES campus? And what I mean by that are those, because of age or health, should not be there, and they're never going to be able to go. And maybe you can answer this at the priority level, because if we moved them to somewhere, we wouldn't have 2,900 still left to. You really don't have 2,900 homeless people that could go get a job and could potentially. You take about 1/3 of that, from my understanding in these meetings, and you remove them, because those are what we're talking about. And then now you have a group left. And so I'm really concerned about that group, and maybe you have any answers to that, or is that the next group of people? Is that the next conversation?
The next conversation is specifically related to the permanent supportive housing, which served our chronic homeless population. I would say our continued support of the staff at the campus, that is their job. Those case managers, they assess each individual. Those staff are looking for what are the appropriate resources and how can we most efficiently and effectively move individuals out of the shelter. It takes time to develop relationships and get those benefits in place and figure out the appropriate resource should there be one. And I think sometimes we get lost in that. You know, a lot of times I hear, well, just tell me everybody who has income and give me the list of names and we're going to get them housed. And a lot of times that's not the answer, because when that rental assistance runs out in 3 months, then we're seeing people cycle right back into homelessness, and that's not what we want. We want to make sure that each housing placement is sustainable and that the resources that go into that make sense, and that we're putting people in a place where they can be successful and thrive.
Well, and that just kind of drives in my point, is there's a large population that are at the CARES campus
Yes.
that will never be able to do that. And so it's a concern of mine, maybe not answered today, but I think it's a priority that we find some of those answers. My other part is I saw your list of all your people collaborating. I think that's fantastic. We use that word a lot in here, and we've been pushing and shoving a little bit to see that. One of my big concerns is I don't see a lot of churches on there, and I don't know if that's because of them or us, but I'd like to help with that, or help make sure they're some of our biggest humanitarians in nature, and maybe they haven't found the right path. Sometimes churches are hard to work with. Those people out there, I'm a pastor, I'm allowed to talk about churches. So I know it's sometimes they have a way of they want to do it, and I know Grant's been working on some stuff to help, but anyway, is there another list of churches? Am I wrong on that?
There is not another list yet. There are a couple MOUs underway right now. One is with Hopes. One, we are working with a partnership at UNR on how they can support. And I would say the faith-based community is next on our list. We do have conversations all the time. This campus has not really been in a state to support volunteers on site and that type of work. There's no meeting rooms or training rooms or places that we can have activities and that type of thing. We've been doing the very best that we can over the last couple years, but the Welcome Center opening up is a game changer. That is where all the services happen. That's where the case managers and therapists will be, with training rooms and spaces that will allow us to invite groups like the faith-based group on site to help with meal service and other services that can come.
Thank you
So,
for your
yes.
presentation. It was very good.
Thank you. And I think just it's worth pointing out, that's why we fought for that permanent supportive housing that will be built in '25. And that is for the folks you were talking about. It's unacceptable that we don't have a place for people who can't take care of themselves, that they are living in the emergency shelter. We are doing what we can on the county side. We couldn't have done it alone. The state gave us Home Means Nevada funds because permanent supportive housing is so expensive to build, because it's for the most needy population. They need, very specialty build. But we look for the community to help us. And I know Commissioner Garcia is talking to a legislative subcommittee on behavioral health for the state, and we need the state to step up again as well, and hopefully the federal government, because we need a place to put people who are disabled, will never work, have a mental health care issue where they need a nice place to stay that is safe for them and safe for the community. And so I know that Dana and her team are working on that, but all hands on deck on that. Yeah, great point. Commissioner Clark.
Thank you, Madam Chair. I've got some questions and a few comments. I'll start with the questions. How is the CARES campus measuring recidivism?
Yes, so the recidivism, and again, just for clarity on this number specifically, this is CARES and Our Place. The CARES number started about 36%, I want to say. I think it was 36, quickly dropped to about 28% in the next 6 months, and now is about 24% if you're just looking at CARES. The way that we are measuring recidivism is after 6 months of being housed, have you returned to homelessness? And that's anywhere in the entire system. So it's not returning to CARES. If you come to CARES, get housed out of CARES, and never want to come back to CARES, that does not mean that you would not be counted if you lose that housing and fall back into recidivism. So again, that HMIS database is measuring the entire community. If you touch any system, if you receive a service from one of those 40 agencies or so reporting into there, then you would come back up on that list and count as in the recidivism number.
So follow-up question, the method that Washoe County uses, is that the same method that HUD uses? Is that the same methodology that HUD uses for recidivism? Thank you.
Yeah, if I may, I might call Katrina Peters up here she might know the answer to that.
Looks like she does.
Good.
Katrina Peters, for the record, yes, the terminology that we're using and the definitions for recidivism do align exactly with HUD. They're the ones that outline how we define those exits to permanent housing and how we define those returns to homelessness. And again, it is community-wide. We're not just looking at returning to a specific program. Anyone returning to homelessness across the community is counted.
Thank you. Next question. How many people were successfully housed that did so with their own income and no federal government support, and just with their own income or resources that they may have found?
I do not have that information, but I'll
Okay.
work on getting it for you.
Next question. Permanent supportive housing. Are we supporting people indefinitely? How does that work, permanent supportive housing?
Yes, so one, this is a criteria. You have to be considered chronically homeless, and you have to have a disability. And yes, it is intended that it could be permanent, but part of the work that those case managers are doing through the support is to get supports in place, monitor progress, and then assess. And if that support is no longer needed, then we would look at transitioning that individual off of supportive housing and into a separate type of housing.
What would that separate type of housing be if we terminated them out of supportive housing?
Usually less services, and again, it is intended to be permanent. This is targeted towards individuals who will need support for the rest of their lives. A lot of times, if we can get people into housing, get people stabilized, offer those services, whatever medical, behavioral health types of supports in the home, sometimes we can find that that is not necessary anymore. That does not happen all that often. So I don't want to mislead anyone. Usually, permanent supportive housing, you're transitioning into that and you're staying in that housing forever.
So do you have any numbers yet on who might be looking at permanent supportive housing and who wouldn't be, who might have been placed in housing and may have been moved out of that? So that's the comparison I'd like to see. And obviously, I don't expect you to have that memorized. I've got another question as well. Do we require people to be sober to get permanent, indefinite supportive housing? Do they have to be sober? Or is that part of the program? When we pay for their apartment, do we need them to be sober, or does that matter?
No. Katrina, I'm going to call you back up here. She's our policy and data guru. I will answer, there are currently just over 150 individuals on the community queue waiting for permanent supportive housing. That is our list that everyone is provided the exact same assessment across the community and added to the continuum of care housing list. There's 152 on that list.
So there's 152 on the list. How many are actually in supportive housing?
None of them. That's the
So
list
none of them now?
waiting for.
Okay,
Yes.
Okay.
And could you just repeat your question on permanent supportive housing?
Well, the question I had is, I had several that we need more information
He had
on.
sobriety
Sobriety,
requirement
and
questions.
Is that part of
So
it?
sobriety is not mandatory as part of a low barrier model, and Brooke Page will also talk a little bit about permanent supportive housing and the benefits of it and the overall cost savings to the community. That's not to say that we wouldn't be working with people on harm reduction. The permanent supportive housing model includes active engagement with those folks to get them connected to the services they need. So if someone is struggling with substance use, we would be actively working with them to get them treatment, to make sure they have the appropriate providers, and actively working with them on that issue.
But there are no requirements that they partake in any programs that you may suggest?
That would be considered a high barrier model, and for our permanent supportive housing 50 units, we're looking at utilizing a low barrier model due to its shown effectiveness and cost savings across the community.
Very well. I've got some other comments I'd like to make. We've got a unique situation. The county owns the CARES campus. It's surrounded by the city of Reno. So the impact of the county facility to the citizens of Reno is something that needs to be taken into consideration. Everyone's focused on the guests of the CARES campus, but I've talked to many business owners, had them filmed, interviewed them, recorded their comments surrounding the CARES campus. There's many things that are happening with the CARES campus being there that's affected the quality of life of other folks there. And I think that's an area that we need to focus on as well. I've suggested that we somehow figure out how to have portable restrooms in that area outside the CARES campus and cleaned on a regular daily basis. I mean, think about this. If you're down on Virginia Street and the closest CARES campus restroom is a couple of miles away, how many folks can make it that far? So I'm worried about contamination. I'm worried about that going into the Truckee River. Restrooms, trash pickup. I'm hoping that our colleagues at the City of Reno can maybe help with that type of a situation. Maybe we can get some partners to help. I'm not asking anybody to work for free, but if we could get a restroom company that would give us kind of a discounted price, we could get some trash containers, dumpsters along there and placed strategically so things could get picked up. We should be considering this, asking the city of Reno to possibly have cameras around that area. I don't know if they do or not, but we need security, maybe a command post watching the activity and reporting it back to the Reno PD to have them act on it in a timely fashion, just again to protect the business owners and the customers and shoppers and clients of certain businesses in that area. Also, I've talked to many folks that live in the CARES campus. I'm down in that part of town just about every day, talking to somebody, visiting somebody. I'm told about the abundance of drugs in the CARES campus. I'm told about weapons. It's a chain link fence around the facility. It's pretty easy to slip something through there. I'd like to see if, and I'm asking the sheriff, if we maybe can have some drug sniffing dogs to patrol that area, and also from time to time metal detectors sweeping around the perimeter of that to see. I've heard, and again, it may just be talk, but weapons hidden, buried around the perimeter in the dirt. So I think that's something that we need to be looking at. Security. As far as housing, until we can get housing, maybe the county could do something, and I brought this up several times, and I'll bring it up again. The county's got 500 or 600 parking spots just out past the Livestock Event Center. I suggest that the county, and I'd like to see the county, if I could wave my magic wand, have the county allow people to park there in the evenings from, let's say, 5 at night till 8 in the morning. If we had some portable showers, some portable restrooms, and that way we keep people out of public areas and a safe place to sleep, and that might be helpful, especially this time of year when it isn't freezing at night. I think I want to give a commendation to This is Reno. I think they're asking a lot of the right questions, a lot of good information. I urge people to check that. They're dealing with a lot of public records regarding the CARES campus, and I think they've got some good, honest information. And then I'm concerned about this area, sending out misinformation or disinformation or information that's not clear, or maybe somebody can't decipher it, or maybe we don't know what the real answer is, and then let other communities, and Alaska comes to mind, Anchorage, Alaska, looking to us as being the entity that solved homeless issues. I think we're a long ways from that, and so to copy us might not be the exact path that we should be encouraging people to follow until we get a better handle on a lot of this. Property values have been affected on 4th Street by the CARES campus. That's going to be a continuing issue. that's lost revenue to the city of Reno in the future if all of these properties continue to be devalued on 4th Street. You know, there's other lives on this equation besides just the folks that are living at the CARES campus. Talked about the drugs, weapons, senior center. We have such a high percentage of seniors living at the CARES campus. I've said it before, and I'll say it again to the county, that we should be working on a senior center or senior activities for seniors that live at the CARES campus in the CARES campus. Instead of having them come across town to other places, let's give them some activities, some things to do, some crafts, some, you know, just things to occupy their time. I also want to give a big thanks to Ann Silver with the Chamber of Commerce. She started a group of classes there. She's got a group that's ready to graduate. I think she's got almost 30 people that she's found careers for, not just jobs, careers. Some of these jobs are paying up to $60 an hour. So I think that we should encourage that type of activity. Partners working in collaboration with the county and the cities and the other entities. If she works with the chamber and they've got serious job opportunities for folks that want them, I think that folks should talk to her. She's been quite vocal about her success over there. And I think Claire that spoke earlier had a very good point. I look around the room, I look around the board. I'm not a mind reader, but I don't see anybody that fits the profile just yet of homeless. I'm surprised that we have a meeting like this and there's really nobody here from, doesn't look like many people, if any, from the CARES campus. I wondered, was this noticed to the CARES campus so we could have people come in and tell us their situation? I mean, it's one thing to talk about this, it's another thing to be living this life. And I think we should have somebody from that community on the board. I think we should have somebody from the business community on 4th Street and surrounding the CARES campus to be on this board so they have some input on what we're doing. Because, you know, we have good intentions, but quite frankly, we're not living that life. And so I think folks that have that insight could really benefit us, the electeds, in the county and help us understand exactly what their needs are. So we have a better comprehension of what the issues are. So, and lastly, you know, with what all we've talked about, what all we've heard about, I think that we need to meet more often than once every 9 months. I think that this particular board, until we can get a little bit better handle on this, needs to be meeting every month. I think this is a hot button issue in our community. Everybody's aware of it, whether you live near it or whether you live in the county, it's on everybody's mind. And I think that to show the public that we're serious about helping with this issue, that we should have more frequent meetings, invite more people, and make sure in the future that we reach out to the folks that are living at the CARES campus and let's have them come down and tell us what they think they need and how we can help them. Let's hear it from their own words rather than folks just kind of guessing what might need to be done. Thank you.
Thank you. Any other board comments? Yes, Councilwoman Vice Chair Taylor, please.
Thank you, Madam Chair. I appreciate Commissioner Clark's comments, and I am very concerned about the businesses too. And some of the comments that were made about restrooms and trash cans, I have actually talked to the experts in this area about adding those solutions, and they are not necessarily good solutions for a ton of reasons. So I appreciate you letting us know about that. And when it comes to the city of Reno and what we're responsible for and working together, I think that there's a great opportunity to talk about CTEX and how we can look at our resources and distribution and enforcement along 4th Street. That would be something that I'm absolutely supportive of in those discussions. As far as, Dana, the people that I want to talk about aren't veterans, they're not families, they're not people that have just got the eviction notice, because what I heard you say is for those people, and I know at the city of Reno, I know at the county, I know at Sparks, through all our rental programs and housing programs that we'll talk about later, we're going to get you the help that you need. If you want help, we're going to get you a bed. We're going to get you a resource. We're going to help you with the assistance that you need in this community. We're going to do it. And I've seen it. My question is for the small percentage of people that we're seeing now on the streets who don't want any services, who are causing our businesses, our residences, our people who are trying to use our spaces, public spaces, they're causing challenges for us. Now, does that come down to a law enforcement tactic? What is the solution? Where do those people go? Is there any place for them to go and have, I've heard people talk about a camping place or a parking lot where the county puts where people can go and it's a zero barrier. Is that something that we're looking at or should we be looking at? Thank you.
We are working through trying to come up with a pilot for safe parking. The idea of that, though, is not for the group that you were talking about. The idea came about for people who lose their housing and need a couple of days or a week and prefer to sleep in their vehicle over coming into a shelter. We're trying to take a look at that. I think the reality is that when you look across many different models, the ones that work have some rules in place. And I honestly am not the best person to speak to this. I definitely took a note and think that the next time we meet, that would be a conversation worth having. We do have many people in the region who've traveled a lot and seen a lot of these different facilities. And when you circle off a space and say, here's a shower and a porta potty and good luck, that usually does not work and creates a different set of issues. And, I think it's important that we remember that we can't force anybody, right? And so we need to address that as a region. So I will make a note and look for an appropriate place for that conversation.
Thank you. And if I didn't say it before, thank you to you and your team. We are very appreciative of everything that you do. And in 4 years, we've made a difference. And we continue to make a difference. So thank you very much. Thank you, Madam Chair.
Thank you. And Councilman Reese.
Thank you, Madam Chair. Obviously, because we have not met recently, there's sort of a pent-up desire to have some of these conversations, but I want to start maybe from the bottom of my notes, and perhaps to the shock of some in this community, I'm going to agree with the Commissioner from District 2 on a number of things. So first, I want to say we should meet more often. The problem is, of course, that this is an advisory body, and when the CARES campus and the county took over the primary responsibilities for sheltering services, much of the work that we had done to get to this point had then been transferred. And so we can have presentations all the time, but we are not taking affirmative votes up here. I'm happy to meet as often as necessary and as often that we can to make productive inroads into this. It is really a crisis of human scale. And so no problem. Let us meet more often. I understand the difficulty comes with that takes time from your staff who's out doing the work and instead putting together beautiful presentations. Second, expanding this board. Certainly, there's no problem with doing that. Again, it goes back to the concept that it's advisory. We don't take votes here on this board to approve a thing or not approve a thing. We're really having a community conversation, and it looks very odd at times because we're sitting up on the dais. The folks that we want to serve are not in the room. The folks that are here have different experiences and reasons for being here, but sure, expand the board. The impact on the surrounding businesses. I think it has had a huge impact on the surrounding businesses and not a positive one. What I would say is necessary there is not necessarily more like an over-policing, but maybe a shared policing, right? If the Washoe County Sheriff's Office and the Reno Police Department and Sparks Police Department want to have some shared responsibility for patrolling 4th Street and making those contacts, I'm sure that that could be arranged with the various groups involved. But it comes down to how they jurisdictionally appeal to one another's senses of good-naturedness, the budgets for doing it. But I would like to see that there was a greater shared responsibility for the corridor there along 4th Street, which connects our two beautiful communities and all of Washoe County. So the impact on the surrounding businesses cannot be understated. I think it's an important thing. And last is this concept of safe parking. It's absolutely something that this community needs. I think it would be included in that would be RV parking. It would be folks who are living in their car. I think this is something we've explored as a community over the years. Really, the safe camp space that's run by Karma Box is sort of the hybrid of that. It really is the in-between stage, because it allows people to get into a structure that is private and they can close a door. But if safe parking is what is needed, I too have thought very constructively about the area where we have the Livestock Event Center. Obviously, the problem arises on how to staff it, how to pay for it, how do you put pods there and showers there that are secure and safe for people. And then you've got events that go in there occasionally, and some of them for many months. The folks at the Reno Rodeo probably would not be very happy to have it transformed in that way. So again, I think part of the issue is that on this body alone, there's some very diverse political ideologies, but the crisis of human proportion really does not care if you're an R, a D, an independent, a nothing. It just wants to see people not suffer. So again, for my thoughts, I'm agreeing with many of the conceptual ideas of the commissioner from District 2, and we can do better. Right? And ultimately, that is the goal, is to do better. And I'm not saying that to say that you have not done a good job, Ms. Searcy. Your team, VOA, Karma Box, Eddie House, Hopes, there's an infinite number of people to list and thank, but they are doing the work, and that staying the course is good. Let us continue to check in to make sure that we're not missing something, that we're not looking past nomenclature and words, because that stuff gets in the way, right? And politics gets in the way too, right? And so ultimately what I want is for us to use this CHAB as an advisory body, meet when is necessary, and make good choices for our community. I think we've done that. Mayor Lawson is a dear friend, and we have some very different political thoughts at times, but this body has been a place where we've found much common ground. The same thing with Mr. Dare, colleagues who have come off of this board. We can do better as a community if we do it together.
Thank you. And Ms. Searcy, it would be great if you would also expand on how we do incorporate folks with lived experience on our many different community groups and policy making that you and your team put together, because we don't want this board to create policy when we know what the best practices are. We know what the national standards are. We know how to get people housed. It's all about time and resources. But if you could please explain what we are already doing. I know that there's several opportunities for folks to make sure that we understand what their thoughts are. Not that that couldn't happen at this board, but it would be helpful if you would outline that.
Absolutely. And again, forgive me, I will probably miss a few things as I am not prepared to talk about this today. But one, I would say we absolutely have lived experience throughout all levels of the organizations that operate these shelters. Both RISE and VOA and Karma Box, I would say a great number of those staff, including many of their leaders, have lived experience. We also have a lived experience committee that was put out this year through an RFP that is part of the local continuum of care. And that board, they have assessed both of the shelters. They have assessed other programs to make recommendations. They also have been a part of the rating and ranking process to determine how HUD funding is used and which programs receive funding in this region. So there has been an effort to include lived experience in our work, but I will follow up with more.
Thank you. Well, I knew about those instances that you brought up, and I really appreciate you highlighting them, because I think it's important that people know that we do take lived experience very seriously at the county, and we listen to those voices. And looking to the rest of the board, any other comments before we move? Commissioner Clark?
Thank you. Just a couple of quick comments. I don't think anybody should be shocked that I'm trying to move the needle a little bit. This isn't a political game for me. This is trying to help people survive. I have friends that in San Jose and other parts of California who've had the parking situation. I'm talking about people that have a pet, have have lost their job, have lost their housing, but still have their job, just looking for a place to sleep without having problems. And there's ways around having portable showers. And so these aren't my ideas. These are ideas that other people have done in the past. Other communities have done this. But people bring it to my attention. I'm just sharing this. I'm sure that you and your staff are doing a great job. I'm just trying to move the needle in a different way, in a positive way. So this isn't politics for me. I'm trying to get people more comfortable in their situation. So so I'd also, and if somebody says that it doesn't work, well, that's fine too. I'm not betting my reputation on it. Just a suggestion. I would like to see where if there's any statistics that says that bathrooms and trash receptacles on 4th Street wouldn't be a good idea. I think whenever you have large numbers of people, restrooms are always a good idea. Trash receptacles are always a good idea when you have large numbers of people. So I'd like to see if there's any particular studies that show that that isn't a good idea. And then if that's the case, then I won't bring it up again. So thank you.
Great. Looking to the other board members, I'm not seeing any other comments on this presentation. Ms. Searcy, thank you so much for your work, for your team's work. It is so hard to do what you are all doing, and you have the support of this board, as you could hear, and we're really excited to continue to support this work and seeing how else we can ensure that we get folks in permanent housing. That's the whole goal. So thank you. We will now move on to item 6. This is the Washoe County Permanent Supportive Housing Needs Assessment presentation, and the presentation will provide an overview of the supportive housing needs in Washoe County. This is by Brooke Page, Corporation for Supportive Housing, CSH. This is a non-action item. Welcome.
Thank you so much.
Yes.
Well, thank you, Madam Chair Hill, Vice Chair Taylor, and the members of this committee. I am really grateful for the opportunity to present information regarding the need. You all had such a really robust conversation, and Ms. Searcy had an excellent presentation, and this is really to hone in on that supportive housing conversation. So it's really timely. CSH was commissioned by the Northern Nevada Continuum of Care Leadership Council to really identify how many people need this very important intervention, and what is the business case for this? What is it gonna cost? How do we do it? What's the process? So that's what we brought in. That's what this report is about. So I'm gonna give you the data and the information. I'm a Nevada native. This is really important for me. I work for a national organization, but I sit at a table at the state level, at various different tables. And so the conversations that you all are having in this community are profound. They're very intentional. And they're conversations that are really helping to move the needle in ways that not a lot of other communities are doing. And I get to hear these things because it's definitely a passion of mine to address supportive housing. But I just wanted to emphasize that because I think you all are moving the needle and you're doing important work. And so having these conversations, narrowly tailoring where the best practices and how to invest your resources is really important. And bringing an organization like CSH in to help do this is also a really important one because we've been doing this for 30 years. We've got 15 different chapters across the United States where we help communities address supportive housing specifically. And our lines of business really help to ensure that we help communities identify the need, identify how to maximize their existing resources and put those resources into action and really help address a very complex issue, which is getting people permanently housed. And so we've got various different ways we do this: training, education. We also are a community development financial institution, so we would love to bring our financial tools to help pair our resources with local fund sources, state fund sources, to really be intentional about building the housing that's needed. It was brought up that it's hard to find developers who really want to do this very important type of housing. And a lot of it is due to a lack of dedicated fund sources. And so we're gonna talk about that. And so the process, we were commissioned last year. The information that I'm gonna provide today is based on 2023 data, but it does not negate the fact that the information is important and it is very timely from this conversation about the ways in which we can put information into action. And so we used last year to come up with this needs assessment. We then have recommendations at the end of this needs assessment that we are working with the community to develop some specific an action plan of how to put that data into action so it just doesn't sit on a shelf and not be useful, but actually be able to be put into short, medium, long-term goals. And then to manage that plan is going to be critical. Where are we? How do we create a dashboard to know that what we talk about is actually happening? How do we monitor that, hold each other accountable to ensure that we're addressing the need? So I just want to go over supportive housing really quickly. You all are probably very well hear this very often, but I think it's important because some of the things that I've heard today, it's important to know who it is that we're talking about and how supportive housing is an intervention, evidence-based intervention that for 30 years has been helping to address this very complex issue. So why, number one, why this is important? You'll notice on your screen, this is the fair market rent right now in Washoe County for 2024. And you see, just for fair market, this isn't market rate, this is fair market rate of what it costs to afford an efficiency unit up to a 4-bedroom unit. You'll notice in the state of Nevada, we have a shortage of 91,000 units of extremely low-income housing that we need in the state overall. But of those, we have the number of units affordable. We've got 13,000 people that need this deeply affordable housing. And so it's very, very critical that we talk about this and that we create it. We did a side-by-side based off of income to show you, ensure that folks that aren't rent burdened or paying more than 30% of their household income on their housing shows you where they can afford as far as Washoe County is concerned. So somebody that's receiving Social Security income, who is making roughly $11,000 a year, ideally they're not paying more than $282 a month on their housing in order to not be rent burdened. There's nowhere here that's $282 a month that they can pay in their housing rent. And it escalates from there. $20,520 a month, $37,923 a month. So you just see here that we have an affordability issue, and we can't talk about addressing homelessness. We can't talk about addressing housing if we also aren't talking about the rise in the cost of how expensive it is to live in the community. And some of the root causes that we're seeing in Nevada that are really prevalent and conversations that have to be addressed if we're going to also be addressing this crisis, not only the rising cost of rents and how expensive it is to live, but also stagnant wages. If we're not seeing wages keep up with the same pace of inflation, we're going to see people falling into homelessness. And the data that Dana showed and the amount of people that were entering the homeless system and versus coming out of it shows, we've got people that can't afford this housing, and their wages aren't keeping pace. We also obviously have an insufficient amount of housing stock, insufficient amount of affordable housing, and we have a definite insufficient amount of supportive housing specifically. We also have an inadequate funding of services. Services are a really important component of supportive housing that I'll talk a little bit about. We also have racist housing practices. And this is really important because if there are high barrier housing that requires people to make 3 and 4 times the rent to get into their housing, or requires folks to not have any felonies or not have any type of background issues, how is somebody that has those issues ever going to get into a home? And that disproportionately impacts a subset of people. And your data shows that there are racial disparities within the community. Also, not in my backyardism, when these housing developments come before a planning body, we notice the community comes to the table and disputes having any kind of housing being built in their neighborhood. Those types of conversations are detrimental if we can't get multifamily developments built that are going to be affordable to people who need it. And so what is quality supportive housing? When we talk about supportive housing, we're talking about, again, an affordable housing. You see that in the middle of this circle here. It's affordable because we don't want people to pay more than 30% of their household income on their housing, period. So it's got to be affordable. But then we also want to make sure that we wrap that household who needs it with the whole person care services. And so there was conversation about, what about the folks that need a higher level of care or need that more higher level of intervention? When we've got services that are rich and providing folks with a very whole person care model, ideally we've got tenancy supports that are not more than 1 to 10, maximum 1 to 15 of a caseload size ratio of a case manager. They can provide and ensure that a person is getting access to the services that they need to be stably housed. And this is really important because this is very different than resident services or a brokerage type of case management model where we're hoping somebody comes to us and asks us if they need help. This is very progressive, it's very engaging, it's building trust, it's building relationships, and it's ensuring that people get access to the services that they need. So this is really important because it's very different than other types of models. Who is it that we're talking about? We're talking about people that need supportive services and wraparound supports. It's folks that are coming out of institutional settings, experiencing homelessness, chronic homelessness, people with intellectual developmental disabilities that could be in the community, in the least restrictive environments, and have wraparound supports to keep them stably housed. And people coming out of our institutional settings like jails or psychiatric facilities that need these type of wraparound supports. So this is a model that is for multiple different people. And these are just the components of it. I won't belabor this point because I want to get into the data. But the Washoe County Needs Assessment, we did a very robust process. 18 different community-based organizations were a part of this needs assessment process, including the voices of people with lived experience who also were able to inform what this means for them to be in a stable place to live. And the high-level information about this report reflects that, right now, one-time capital cost is roughly $300 million it would take to build the housing that we need to address the need. $300 million, and an average of $50 million a year to keep people stably housed. So those are the dollar numbers from the report. And this is really important because you all already show a 94% utilization rate of supportive housing in this community. And so the importance of focusing on an intervention that works, that's being done well in this community is really important. What we're showing is we need to build 652 affordable homes in Washoe County and operating rental assistance for 3,814 households. And so these households are folks that need, that wraparound supports. We also have different ways in which we look at this data. We've got folks that need, from a building perspective, but then we also have really important landlords in this community that have stepped up and have been providing housing for folks and utilize tenant-based rental assistance to keep people stably housed. And so that scattered site model is also an important model to supportive housing. So I'll just pause there. I see that the time is out, so I'll just see if there's any questions before I move on.
And if you want to highlight, I'm sorry to be restrictive, but
Yeah.
the board typically tries to end at noon. So, and my childcare leaves at noon today. So, if there is anything you want to just highlight quickly on the rest of these slides, that make sure that we know about.
Yes. Well, I'll just go to the end here. So here is where you show the annual need and the unmet need. We have about 1,284 individuals that need supportive housing, 21 families that need this particular type of intervention based on the data that we used. There's also 1,644 individuals that need rapid rehousing, that just need, really quickly to get into a housing intervention. And with supports, they can receive rental assistance for a shorter period of time. And then 81 families. And then diversion is an important intervention that the community needs to stand up. And this is what also was talked about, the importance of keeping people in their homes or doing some housing problem solving so that way they aren't experiencing homelessness. Maybe they just need assistance with their rental assistance, that $40 that somebody mentioned earlier, keeping somebody in their home. There's about, if we had resources for 752 people and 32 families, we could stand up a pretty robust diversion program. And this is just the capital cost. I went over those numbers, but this is in your report. You show exactly from how many units if we build it, how many units if we operate it with operating supports and services, and the total number of one-time costs is that roughly $300 million, and then the annual of $50 million a year. And we did a business case that this is a cost-effective intervention. You all have a really great, robust system already in place in your community, which is phenomenal. We look at utilization rates to see, where should resources and investments be put. And because, your CARES campus is being utilized really well, it appears that we have the interventions that we need as far as emergency housing. But what we show here is that providing somebody with an apartment and wrapping them with services is way more cost effective than allowing them to cycle in and out of the emergency rooms and out of the hospitals, staying even on the streets and getting access, to other folks that have to intervene with those folks on the streets. So why not ensure that we put the investment where we know not only is it cost effective, but we're going to get the return on our investment and people are going to increase their income, they're going to thrive, they're going to increase their health outcomes. There's so many benefits with supportive housing. It's definitely the most effective intervention. And then at the end, we just have some recommendations. And so that's what this action planning body is going to be working on. And we are excited about them really thinking about these numbers and putting this information into action.
Thank you, Ms. Page. Wow, this is great work. I'm so grateful that you did this work for the county. I'm wondering, Ms. Searcy, don't get too comfortable over there. I have a question for you on what is the county going to do with this and all of our partners going to do with this data next, and how are we prioritizing this, and what's the big dream here, and how can this board help support this work, because it's so important.
Dana Searcy, Washoe County. One, I would say, we live this every day. We talk about this every day. This is a huge part of the continuum of care and is that gold standard of the resource that we are so desperately in need of. I think this was lagging just a little bit behind some of the conversations that we'd had. We had hoped to have this to bring forward to our board specifically when we have conversations like we need money for the Affordable Housing Trust Fund. This is the housing that trust fund is funding. We would like to take 3 acres and lease it to a developer, and this resource would help provide information to the board about why that is so useful and why it is cost effective to do that. So we wanted to have a gauge in the community of exactly how much do we need and how much does that cost so that it can guide all of our conversations moving forward. And I do think that it is a fair statement to say that this guides our work every single day.
Great. And Ms. Page, quickly, and then I'll go to the rest of the board. How have you seen communities use these reports and just remain laser focused on getting the work done? Because I think $300 million feels really overwhelming. Mm-hmm. I heard some groans like, oh my gosh, how are we going to do this? Where have you seen great successes of taking this to the next step?
Yeah. So great question. Thank you, Brooke Page, for the record. We have seen this type of information be used in pipeline work groups throughout the country. And so right now I'm working on one in Dallas, Texas. They just passed a $1.2 $25 billion bond measure in Dallas, Texas, that is really being focused, some of which is addressing housing. And now that they have information as far as how many units they need, and what that timeline is for those units to be developed, they can absolutely now laser focus to that bond measure and track how that bond measure resource can be used to address and take down that need number, and create a dashboard so they can track how many units for this particular area median income or certain populations are being developed, and have something to be able to just have to respond to. So that's something that we're doing specifically on my team, focusing in Dallas.
That's a great example. Thank you so much. I'll start on the left-hand side. Commissioner Clark, do you have any comments or questions?
No, thank you.
Thank you. Councilman Dare.
I just want to say, looking at those numbers, they are daunting. And obviously, we have work to do one step at a time. And so thank you for your presentation.
Thank you.
It's great to know,
Yes.
though. We
Yes.
now know what the real need is. Mayor Lawson?
So I understand the need for supportive housing. As you're going to hear from the Sparks report, we paid $2.7 million for 0.95 acres in downtown Sparks that we're giving away to do subsidized housing. I mean, 300 million seemed pretty low to me at that number to help 3,500 families. So we taken into, I mean, we're out of land in our county pretty much at this point in the cities. But where do we come up with $300 million?
It's an excellent question. But for the record, I believe that having an opportunity to identify what current resources are available at the state level, as well as the local jurisdictions, and thinking about philanthropy and other fund sources that we may not even be considering, is part of the exercise that needs to happen. Where are we not maximizing our current resources? And then identifying the gap. And so part of what the pipeline work group here in this community will be tasked with is identifying how do we make recommendations to ensure that we are going after every dime that we are entitled to in this community. And then also, are there other types of fund sources that we need to be exploring or considering in order to address this deficit or gap that we have. But without sort of understanding that and identifying those fund sources and having that specific conversation, things feel very big and anecdotal, but this will allow us, to really laser focus and identify what do we have and what don't we.
Councilman Reese.
Thank you, Ms. Page, for the presentation, and my apologies that it got somewhat abbreviated. I was able to review over the weekend all the materials, so I think the presentation was excellent. I suppose my first question is really to the chair and then back to you. I didn't understand the $300 million number because there's two different places today where we've heard this number. One is on the cost that we've spent to date in the general, we'll call it the homeless services sheltering area in the last 5 years. And the other is the assessment that you've made, Ms. Page. So because what we hear in this community is there is a group of people who think we are spending too much on this issue, right? And they think that we're spending it to the detriment of other people like our seniors. And so it's like a Hunger Games style scenario where they're pitting one group against the other, right? And so I'm trying to figure out, this needs assessment was done by Washoe County to provide a roadmap for future endeavors, is that correct?
Yes, and honestly, all hands on deck. So permanent supportive housing and also affordable housing and then housing vouchers as well to understand the real need because we're not meeting the need, as we know.
And Ms. Page, then I take it that your response to Mayor Lawson was really about thinking critically about the way in which the federal government has a role, the state government has a role. It's not that you're saying the $300 million all must come from, and we'll say it kindly, the county tomorrow. It's that we all have
I don't know how we'd even do that.
I totally understand. Right. So it's really about an all hands on deck approach that you at CSH have posited.
Brooke Page, for the record, absolutely. Great point. And there's 3 legs of the supportive housing stool that are critical, the capital dollars to build it, and that's the number, that $300 million that we've put out here. And a lot of those tools come from our housing financing tools. Low-income housing tax credits is one of the largest fund source to develop affordable housing. And so identifying how we leverage those tools to develop and get to this number is part of that exercise to identify the various different fund sources.
And so the needs assessment that you did for this community, and it's really excellent work. I know it's very hard to distill it all in 30 minutes or 40 minutes, whatever we gave you. How are we doing in comparison to other communities that you work with? Like, do you have a way to give us a scale? Are we getting a B, a C? Are we failing? How do we gauge our path forward if we're not willing to accept where we are today?
Great question, Brooke Page, for the record. I would say that this community is really on course, doing far and above what a lot of communities are doing, just because you are willing to have the conversation. You're willing to develop reports to give you data and information to make informed decisions. And so a lot of communities are not doing that. So I would absolutely, grade you a B+ because of the fact that you are putting yourselves in positions to make informed decisions. And so now what we're going to, as far as doing with that data and using that information, I think that's the next step, and what we're hoping this action plan will be useful to help inform what happens next.
And I take it that that is work you're doing with the county, meaning you've come to give us a presentation today, which I've greatly appreciated, but the work, and you've been hired to do the needs assessment and then work in the future with the county. Is that correct?
Correct. We have, this next step is developing the action plan with a group of stakeholders across the community that are coming together to take this information and say, okay, what's realistic for Washoe County for short, medium, long-term goals is what we're doing next.
And you said in your presentation you are a Nevada native, which
Yes.
I love. I suppose one of the responses you gave to the mayor's question was about a community, maybe it was Houston, where they passed a bond issuance, like $1.6 billion. So it sounds like there are other tools that we would have to unlock potentially, whether it be a bond issuance. I think the county has some taxable rate in that could be turned to GST tax. So you're saying that these are the types of tools that would be needed in order to address the assessment.
Brooke Page, for the record, I believe that we want to help this community identify all of the various different options, and using examples like Dallas or other communities in terms of how they're doing that is a great, I think, resource of having a CSH at the table, because we're working in these communities, so we can kind of bring that best practice or examples to the table, but this community has to figure out what's best for this community, and identifying that plan is really where the next step is.
Well, and we have some history of having done that in this community through the WC1 issuance, but the question becomes, how do we're already being stretched pretty thin, right? And some tax structures are regressive, they don't hit the mark, and so we're struggling as a community because our property tax is declining, and depreciation happens, and then we are not having as much help as we probably need from our federal or state partners, so we're struggling. And I just think it's good to recognize that. I think your needs assessment hits on that, but also posits that we've got to chart a different path. Thank you so
Absolutely.
much.
Thank you so much.
And Vice Chair Taylor.
Thank you, Madam Chair. Thank you so much for the presentation, so much information, great work. A couple of questions. You mentioned a working group. I imagine that you're working with the Reno Housing Authority as one of the stakeholders in this space. Is that correct?
So the Northern Nevada Continuum of Care is the Leadership Council is what we're working with on this project.
Okay, so I'm part of the Reno Housing Authority Board, and what I'm understanding from your executive's summary is we try and get more vouchers or for whatever to get more people services. We still have a tremendous wait list. But even if we were able to secure more vouchers, more funding, what your executive summary says is we're 650 homes short. Even if we have the money, the resources, financial resources to give to people to get them into homes, we don't have the homes. We don't have the inventory. So In your experience, what are some of the, and I'm hearing this from different things, all different places. We all have rent programs. We do sewer credits at the city of Reno to try and make it pencil for some of the developers. But what are some of the things that we can do as far as a community to get more inventory? Is that working with affordable housing builders, incentives, barriers to entitlements, housing density bonuses? How do we get more inventory?
Thank you. Brooke Page for the record. Thank you, Vice Chair Taylor. In the recommendations, all the things you just mentioned, and what we're finding in other communities as well is developing a joint notice of funding availability, where we are literally bringing all of the financing to the table and targeting a priority from a funder perspective, and telling the developer community that this is the population that we want served, this is the target, this is the type of housing that we want to see developed in our community, here are the land that may be available or the various different resources, here is all of the financing that we have, we're going to put it all together so you don't have to go out to all these different places and try to figure it out. We're going to bring it here under one notice because we're being intentional about it, and we want you to come and apply and go after these funds. That approach has what sparked the innovation in Houston that provided for them to work with the Housing Authority, the social service community, and the local jurisdictions to target a very intentional development pipeline strategy. And we've seen that also in King County and other communities where that NOFA drove the priority and didn't just kind of haphazardly hope that the developers did it on their own, but that it was communicated.
Thank you. Well, this was a great presentation and lead into our next ones, and really looking forward to continuing to work with you, Ms. Page.
Thank you so much.
Thank you for your work on this.
Thank you so much. Have a great day.
You too. All right, we are going to now go to the City of Sparks presentation number 7 of recent housing efforts, including but not limited to the acquisition of property through the Home Means Nevada initiative and rental assistance. Amy Jones is here from the City of Sparks, and this is a non-action item. Welcome.
Good morning. Good morning, members of the board. For the record, my name is Amy Jones, Housing Specialist for the City of Sparks. And I'm before you today to provide an update on the City of Sparks housing efforts since the last time I was before this board in September of 2023. The City of Sparks was awarded $2,871,000 in Home Means Nevada initiative funding to purchase vacant parcels throughout the city for the future use of affordable housing. The city has purchased 2 parcels located at 2026 I Street and 306 10th Street. The city will issue RFPs for each of those sites, soliciting affordable housing projects, and the City of Sparks will make that final project selection. The deed will be restricted through a declaration of restricted covenants running with the land, which will require the units constructed on that site to serve households earning 60% or below the area median income, as well it will require a 50-year affordability period. So this is the 2026 I Street where it's located. Audi Boulevard is located about 2 blocks to the north, and Prater Way is about a half a mile to the south here. It's 0.207 acres in size, and city staff does estimate 12 to 14 units could be built on this site. And the RFP for this site will be advertised in the upcoming week. And then this is the second site and the one that Mayor Lawson referenced. This is 306 10th Street. It's located near Victorian Square on the corner of 10th and Avenue of the Oaks. It is just under an acre of size. And we did look similar sized parcels in this area. So the deco is just to the south, and that property includes 209 units. And then to the west is Square One, and that property has 100 units, so quite a range of how many units may be built on this site. I do just want to mention the site does have a vacant structure on it that staff is currently assessing what that disposition of that building will be. So this, that's going to delay the RFP for this site. The City of Sparks was appropriated $3 million in funding through AB 396 for fiscal year 23-24 and for fiscal year 24-25 for the purpose of providing rental assistance. 2 programs were created, and that was the eviction prevention and the short-term senior rental assistance programs. The eviction prevention program provided 3 months of assistance to prevent households from being evicted. Eligible households must have experienced a financial hardship or emergency that has caused them to be unable to pay their rent. And then also the short-term senior rental assistance program provided $500 per month for 6 months to assist seniors that have experienced a financial hardship, emergency, or experienced rent increases. The city did partner with the Reno Housing Authority to complete the processing, approval, and payment of all of those applications. City staff did begin meeting with residents and accepting applications in October 2nd of 2023. And as of today's date, all of our funds have been expended. We received 341 applications. 303 of those were approved, 38 were denied. The average time for processing from when we received that application to when payment was issued to that landlord was approximately 20 days. And just a few statistics here. This is the breakdown of the area median income of those households that were served. And as you can see, just about half of those households fell in that 0 to 30% range, while 26.8% were in the 30 to 50% range, and 23.5% were in that 51 to 80% range. And households that had income above 80% were not eligible for the assistance. Average household size was approximately 3 people, with 1, 2, and 3-person households making up the majority of households that we did assist. And of the 303 households that we assisted, 181 included were households with children. Average rental assistance payment was $4,268. Again, all of our funding has been expended. 88% of the funds went toward rental assistance, and then 12% went toward administrative fee, and that was both between the City of Sparks and the Reno Housing Authority. And this slide here just shows where the funds were distributed throughout the City of Sparks. It does show that we were able to assist in quite a range of areas of in our city. The city's emergency rental assistance programs are anticipated to resume July 1st. We are going to make the following changes. We are going to reduce the eligibility requirement for that area median income from 80% to 60%. And we are also going to increase the amount for the senior rental assistance program from $500 to $750 per month. And the reason we're doing that, what we saw with the seniors, they were eligible for both programs. However, with the eviction prevention, they were able to get more assistance and help their household stabilize. So we're thinking with this $750 per month, that will give them more long-term. The 2 programs are more in line with each other, and it will give that senior the option to choose which program will help them in their situation. And that concludes my presentation. I'm happy to answer any questions.
Thank you, Ms. Jones. And I'll go to the Sparks representatives first. Mayor Lawson, do you have anything? Okay. Or comments as well, Councilman Dare?
Yeah, I just am very proud of what is happening. But I do want to say that the part of the reason that we can focus on what we're focusing on is because the county's focus. And I appreciate
saying
that very much, is that we each have a role to play, and the stopping of people going into the homeless situation, I do believe that's if we, as cities, truly focus on that, as well as coming alongside where we can. It's really a team effort, but our staff is fantastic. That I always have to say. Thank you.
Absolutely. And I was curious, and this may be a different program, but is some of this going to unincorporated Washoe as well, or no? Your next round of funding?
The funding is going to only assist City of Sparks residents. The council did discuss that, but based on the need that we saw during these last 7 months, council wanted to keep the funds within the City of Sparks so we can help those
Okay.
residents.
Thank you. Commissioner Clark, do you have anything?
No, not at this time.
Thank you. Okay, Vice Chair Taylor or Councilman Reese?
Thank you, Madam Chair. Ms. Jones, excellent presentation. Thank you for the work that you're doing. What happens when someone calls your office and they say, hey, here's my address, and you look it up to get through the screening, and maybe they're in Reno? Do you give them a warm handoff to the folks over doing the same similar work at City of Reno or to the county?
We provide them with the contact information for the City of Reno and their programs, and we do have all the various ways that residents can contact Reno through the phone, email, and walk-in, and we do provide that to
Awesome.
them.
Thank you so much.
You're welcome.
Okay, any other board comments or questions? I'm not seeing any. Great work. Thank you so much for presenting to us. Okay, next up, we have item 8, the City of Reno presentation to provide program updates on affordable housing and rental assistance activities. This is a non-action item, and Monica Kirch is here from the City of Reno.
Good morning, Madam Chair, board members, Monica Kirch, City of Reno, for the record. This morning, I'm going to give you, excuse me, I'm froggy if you can't tell. I had a graduation this weekend, so
That's exciting.
I was screaming a lot. I'm here to give you a brief presentation on our programs that the Housing and Neighborhood Development Department administers for the City of Reno. And you'll notice that this presentation is pretty similar to the one I gave last year, except that was for the whole fiscal year, and this is going to be numbers to date through the end of April. Okay, I'm going to start today with our rental assistance program. Our rental assistance programs offer short-term 3-month rental assistance support to households within the region that is in the City of Reno, City of Sparks, and Washoe County. From these numbers, you can see respectively how we helped residents in each jurisdiction. And to date, we've assisted nearly 1,000 households, totaling about $2.5 million. This is pretty in line with what we've accomplished the last several years. Last year, I think we were in the 1,200 range, and then 1,400 the year before, so I expect to be somewhere in that range again. This slide, you can see that households, while 3 months is the maximum amount that households can get, I think it's important to show that the average was 1.81 months, so folks weren't taking advantage or needing the entire 3 months, and the average per household was about $2,600 in assistance. An exciting new program that we started a pilot with this year was an interim assistance for cost-burdened seniors. And what we did with this program is our staff who administers the rental assistance qualified seniors that were already in the 60% or below median income group. And then if they were paying more than 30% of their income, for 6 months, we gave them a reprieve, and we paid the balance between what they were paying and the 30%. So we were able, through this program, to help 174 seniors with an average of $1,500, and our budget for that program was $273, and we expended it all. Another thing we started after we came out of COVID, where we had all the resources, and it was 15 months, up to 15 months of assistance, and then 12 months. Once we transitioned back to a real emergency rental assistance program, we wanted to start getting other data besides just number of rents paid, number of households. We wanted to get other information like their housing situation at the time, or satisfaction, or other resources that they needed. So last July, we started sending out surveys. So this July, we'll have a year's worth of data. This period is just for the last surveys that went out. But as you can see, I think it's really great that 88% of the folks that responded are still housed, and most of them in the same unit that we help them with. But something that we're looking into right now, implementing, is possibly sending the surveys out via text. We're hoping that we might get a better response rate with that. So we're working with our IT department to try to implement that and see if we can get some better data. And here is the stuff I always like to share. I like to share these notes because I think, there's some things that we can pull out of them. And for these ones in particular, what I got is one person that responded said this saved them from entering homelessness. Another person said we helped them just in a time of need when they were in between jobs. And another one was a compliment of how quickly we were able to help them when they were, already 2 months behind. I have a few more notes, and these are different, and I think they're important because we hear a lot of negative about what we're not doing, and I think that these are just really, this is notes of people thanking staff. They're really kind words of their kindness, their thoughtfulness, and assistance going out of their way to help somebody even find a new apartment, because we want folks to be able to be sustainable in the unit that they're in. So these are like feel-good things and not real data, but they're happy. So with like other programs, our program also has eligibility. And with ours, you do have to be, for all of the programs, under 60% AMI, and then there's a variety of documentation that you need. But we do have staff available for walk-in hours, 3 days a week, 2 hours a day, and then we have a housing line where folks can call and get assistance walking through the online portal, or if maybe they don't have, say, an ID, there's ways to get around some barriers. We can use clarity cards, things like that. So we try to help in all areas where we can. Next, I would like to talk a little bit about housing units. During this time period, through the Washoe County Home Consortium, which the city is the lead for, we are able to approve funding $4.3 million towards 4 new affordable housing projects, which will be another 580 units coming online in the next couple years. I think it's also worth noting that through this program, in the last 5 years, we've contributed funding towards the development of 3,500 new affordable units. These are 60% and below units. They're not permanent supportive housing. They're just regular affordable units for folks that are, if it's a family of one, maybe in that $40,000 a year range. With this, I'd also like to say that 2 other projects that the city has contributed to in different phases, one the Village on Sage, and then also Highway 40, which are still under construction. We donated land, money, and we are working with VOA and the Community Foundation of Northern Nevada on both of those projects, also funding from the state of Nevada towards those. And those are those lower income units. And at the Highway 40, it will also be with a coordination with NAMS, and it's going to be housing for those preference with mental disabilities. Let's see. Here are some other tools that we use in our toolbox. In addition to direct funding, we also have some other unique tools that help get those projects penciled and built. One of them is historically, well, at least since I've been at the city of Reno, the city's been committed to allocating our volume cap towards affordable housing units, and last year it was $16.3 million. In addition, we contributed about $3 million in sewer waivers and building permit waivers towards new units. And then along with some other jurisdictions, we also do parking reduction and density bonuses. I'd also like to say that for the two housing developments on the CARES campus, both of those projects, the Line Drive and the other project, also were recipients of the sewer reduction fees. So. In addition to our rental assistance and housing, we do a lot of improvements in neighborhoods. And these neighborhoods are low to moderate income neighborhoods. We do sidewalk improvements, ADU improvements, parks, facilities, and try to make improvements at those facilities that, being a less affluent neighborhood, there might not be dollars for them to happen. So in the last couple of years, we've put about $3.5 million into some of the parks, like Paradise and Robin Hood, to make those special for the residents living in that neighborhood. But this is a program that just got, the community cleanup program is a program that just got transferred over to our department. And while it's open to everyone in the community, I think it's important to note, and at least I know anecdotally from being out at the cleanups, as with some of our council members, many of the folks that are using this free service are ones that maybe cannot afford to pay to have their waste disposed of properly. So it's helping the same folks in that income range be able to live in their house safely without debris and things like that. And that is all I have for my presentation, and I can answer any questions if you would like.
Thank you very much. Great presentation. We'll go to
Trying to get you out of here.
No, that was great and really great programming. I'll go to the City of Reno first. Vice Chair Taylor.
Thank you, Madam Chair. Thank you, Ms. Kirsch, very much. A quick question on the funding. When we looked at some of the Spark stuff, I think it was related to AB 396. How much of AB 396 did the City of Reno get, and what are the additional funding mechanisms for our program?
We got the same amount as Sparks. We got the $3 million over 2 years. In addition, we use, they're not called LIDF anymore, they're called ODIF. They're from the state, they're trust funds dollars. We use those for rental assistance. We had some home ARP dollars that we applied for rental assistance, and we use ESG.
Okay. Well, thank you. I mean, 808 households in City of Reno, 100 households in City of Sparks, and 25 households in Washoe County. So when somebody comes to the City of Reno or to your division, and do we serve everybody?
Excuse you?
Do we serve everybody do we have to send somebody to City of Sparks or Washoe County or RHA or where?
We serve the folks that come to our program. We do cross-reference to make sure that if it's a Sparks resident, that they're not already receiving assistance from Sparks. But if it's Washoe County and they're eligible, we know that we're the only ones serving them, so we provide them assistance.
Okay, thank you very much.
Councilman Reese.
So many names we've got to be called
Sorry.
by. Ms. Kirch, thank you for the presentation. Much of this, of course, we're aware of. One thing that I wanted to understand was a comment that you made about the rent subsidy. So if someone comes and the difference between their affordable metric and what the rent is, you're saying you're working with landlords to cover the shortfall? Is it like $300 and that's how you use it through that fund?
Yes, that was for our pilot senior program. And so we targeted seniors that were living in affordable units because obviously they were already qualified. And then a few other seniors reached out to us that they heard about the program and we were able to assist them. And yes, because after the 30%, you're considered cost burden. And so we were trying to give them some reprieve for a short term. So for 6 months after we qualified them, we were paying the difference between the 30% and what their actual rent is.
And so in that pilot program, have you studied the sort of the efficacy of it, meaning it kept seniors in their homes What happens at the end of the 6 months?
The 6 months isn't over yet. So the 6 months will be over the end of June, and then we'll be pulling that data.
So essentially, it's a form of universal basic income. You're just saying there were people who qualified through the pilot program, and you gave them 6 months of a guaranteed universal basic income in that period. And when that 6 months is over, you'll what? Go out and collect the data on it and then report back to this body?
Yes, we'll be reporting back to a variety of bodies and then deciding if the funding is available again, if we can do the program again next fiscal year.
Okay, and then last thing, it'll just be a plug for something that I would like to see all of the agencies or the partners do, which is more on the legal service protections, right? Washoe County has a law library where we often do lawyer in the library, and a lot of those things end up being landlord-tenant issues. I think that Nevada Legal Services, Washoe Legal Services, the Rural Legal Services Group, there's just a need, and so perhaps that's one of the things that we could look at together as across the jurisdictions, is finding ways to have people get who have low or no income have some legal services representation through volunteer lawyers.
And we do partner with those agencies. If somebody comes to us, depending on what their need is, we refer them to either the legal services or to, I'm having a brain freeze at this very moment, Silver State Fair Housing, sorry. And then we're also working with Reno Justice Court. They're looking to stand up a eviction diversion court. So we've been meeting with them, with us and the Housing Authority for the last several months, trying to see how that program can get stood up.
Great, thank you. Mayor Lawson?
Yeah, I just want to congratulate the council from Reno. I saw that you guys are moving forward with the purchase of some land from the RTC. When I was looking at that, we got 650 subsidized housing units that would be in perpetuity. I'm 100% in favor of that, and you guys are doing a great job as far as moving that forward. So thank you.
Thank you.
Thank you. Councilman Dare? Oh, yes.
So Mayor Lawson's being kind and he's always humble, but that was a joint project. RTC had a role in it where the chair, Mayor Lawson serves as the chair, and TUMWA also had a role in it. So all three agencies had to be able to come together to make that project happen.
Yes, thank you. It takes teamwork, and we're seeing we've got to do a lot more of that to get more of these housing units online. Councilman Dare? Okay, Commissioner Clark.
Thank you, Madam Chair. I'd also like to bring your attention to a new nonprofit here in the county that's helping seniors, and I like to focus on seniors because it seems that they've been sometimes put by the wayside, but it's called Senior Rescue. And Senior Rescue is started by a local developer. He's asking other developers to get involved, but Senior Rescue pays, an example, if somebody got a $200 a month increase in their rent, they would pay $200 a month for them for the next 12 months to give them an opportunity to seek out other arrangements, either renegotiate with their landlord or find another house. But 12 months gives somebody a little bit of breathing room rather than you've got 60 days to decide if you're going to pay the $200, which you don't have, or leave. So Senior Rescue, so folks might want to look that up and see if there's any opportunity to help, and you might be able to send some people that way. Thank you.
Thank you. I also just wanted to note real quick that with the senior program and with our other programs, if it seemed that folks were really too cost burdened, that our staff was trying to help them get into other units that would be more sustainable for them. So once the period was over of their assistance, they would be in a unit that was better for them.
Great. Did you have anything? Okay. Okay. Well, thank you for your work, and I cannot wait to hear the outcome of your pilot project for the seniors, and I'm sure you're going to show great outcomes on that. So looking forward to having those conversations. Thank you.
Have a good day.
Now we are moving to item 9, board member announcements, reports, and updates to include requests for future board agenda items. I'll start over here, Commissioner Clark.
Well, I'd just like to reiterate what I said earlier about having other folks on the board, people from the community, the folks that are living at the CARES campus. I'd also like to have local business people whose businesses and jobs and livelihoods are impacted by the CARES campus and the surrounding activities. And that's what I'd like to have for future agenda items, is more meetings and more community involvement in this. Thank you.
Thank you. Councilman Dare?
So I would echo something I think we've said we're looking at is more regular meetings. I would just ask that we could do that, and we can talk about that in the next, what that looks like. The other portion is regionally, it'd be great to know if we're really grabbing onto all the grants we can with the collaboration we have in the region, because what I've seen across a lot of other states is they do not do what we do, and a lot of our federal and state, they're more apt to give those to and award those grants to people who are working together. Thank you.
Thank you. Mayor Lawson? Okay, Councilman Reese, no, Vice Chair Taylor.
Thank you, Madam Chair. I think just following up with Ms. Searcy and talking about possible zero barrier solutions at some point in time. Thank you.
Thank you. Okay. With that, we will now move into item 10, which is our final public comment. Comments heard under this item will be limited to 3 minutes per person, may pertain to matters both on and off the board agenda. The board will also hear public comments during individual action items with comment limited to 3 minutes per person. Comments are to be made to the board as a whole. Madam Clerk.
First up, we have Michelangelo Aranda, followed by Penny Brock.
Good afternoon. I guess that's the first time I've talked today. Good afternoon, Chair Hill, Vice Chair Taylor, and Board. My name is Michelangelo Aranda. I am a resident of District 2 of Washoe County. I'm a City of Reno resident in Ward 2, soon to be Ward 6. I'm also a candidate for Ward 6 councilperson. I wanted to talk a couple of things about homelessness, especially I wanted to give a personal story as well. A couple nights ago, I was driving down Steamboat Parkway in the evening, and I almost hit a person who was unhoused, and freaked me out. As you know, some of the deaths that are happening with the unhoused, a majority of them are caused by traffic accidents. And so it got me to thinking. I pulled over, I spoke to him. He was a very lovely gentleman. He was pushing his cart and bringing some of his things over across Steamboat Parkway, which is a 4-lane, about to be a 5 or 6-lane road. And I had asked him why he was crossing in the middle of the night, and he said that he was asked by security or police. He couldn't be sure, I can't substantiate, but to leave the shopping center, as that was private property, and so he was crossing the street. It's unfortunate. One of the things I have fought for, especially as the roads are getting busier in South Reno, is public safety and traffic concerns. And so I think that we could do something to work alongside them, as we did with our children. Our children are crossing busy roads. We volunteered, or we asked for volunteers, and we also got the community involved to donate high visibility vests, as well as flags across the road. It's not a permanent solution. Obviously, it's easier to ask for housing and to get them in a housing situation. But in the interim, some individuals are living on the street, and that's something that we have to come to reality with, and to ensure that we're providing them with the proper resources to be safe out there. There's another nonprofit out there that is also working with those individuals to provide them with luggage bags. So if anyone had any extra ones, they could donate it, to ensure that they also have, instead of a shopping cart with them, they could put all their belongings in a luggage bag, which they could take on a bus. They could also take it to the CARES campus and feel safe with their belongings versus having to lunge around a shopping cart or a bag full of items as well. I want to take the last few moments of the public comment to talk about something that Commissioner Clark had mentioned, which I think is awesome, is trying to think of an idea of where individuals can go if they don't want to be at the CARES campus or want to use other means of being housed, whether that's in their car, in a tenting or a camping situation. Our neighbors to the west in the city of Sacramento piloted a program called Camp Resolution. I would advocate that anyone looks that up. It is in its pilot phase right now. The only thing that's going wrong is that the city has stopped giving them them public or trash pickup and water delivery. But I think that if we were to fund that, that's a
Thank you.
Penny Brock?
Penny Brock, Washoe County resident and taxpayer. So I've sat there this morning hearing all these numbers, hearing all these different agencies and nonprofits and developers, et cetera, involved. Looking at the numbers, they just don't match up for the amount of money that we're spending. And it might be great to have all these great ideas, $300 million bond issue, et cetera, $50 million then a year from we, the taxpayer, to fund that. This all comes down to we, the taxpayers. We know we're going into a recession. We know that our federal government is $35 trillion in debt. Washoe County is in debt. How much burden are you going to put on the taxpayers? That's the question that needs to be asked. Those on fixed income, the 100,000 seniors, we can't afford anymore. What about our young families? The moms and dads are both working, oftentimes 2 to 3 jobs. And then in July, our property taxes are going to go up again. When is it going to stop? It might be great to have this idea to help the homeless, which I'm for. But we really don't have that many homeless in the county to justify all of this tax money coming from the federal, state, and local level. When is it going to stop? When is there accountability for where this tax money is really going? We can't get an audit done at the CARES campus. We don't know where the money's going. We as taxpayers have a right to know. When I do a public records request now, they refuse to provide answers to my public records request. Why is this not transparent? When are we as taxpayers going to get answers about where all this money is going? Why is the homeless, the recidivism rate, it's dropped from 25% now down to 21%. We're not getting what we're paying for. And then I learned today that this Built for Zero, we're the only ones in the state that have it. So now all the other counties are sending their homeless to Washoe County. What's to say that California isn't sending their homeless to Washoe County?
There's nobody else signed in.
Thank you, Madam Clerk. Thank you, everyone, for a great meeting, and looking forward to the next one. Have a beautiful week, and thank you.